Last part of today's lecture is barriers of health communication. So this has also come as a short note. So linguistic barrier. So Abhishek had a linguistic barrier when he was doing that counseling. He could not remember what he should tell breast milk in Bengali. So that was a linguistic barrier in his communication. So nowadays we are so much into Western Korean content that we forget speaking in our mother tongue. So that becomes a barrier because our patients will not speak in English or Korean. Okay, they will speak in Bengali. So as much as you should know English, I think you should also improve your skills in your local language. That will act as a barrier otherwise when you are communicating to the patients, because very frequently I've seen doctors throw English words towards the patients. Okay, and those patients are simply flabbergasted that what are these words doctor is telling me. So for that, you need to have a good hold over your Bengali or whatever local language you are good with. Okay. So that can be an important barrier. Like cultural barrier. Suppose you're going to the community and you're talking about obesity and you're asking them to have avocado in Uluberia. Will it be very good, Merunisa, to tell them to have avocado and zucchini there?
No, sir.
So what should we ideally recommend them? What is locally available or culturally acceptable to them
Sir, for what disease?
for prevention of obesity?
Sir, they should be avoid. They should be told to avoid sweet or junk foods, street
And to
foods,
have
and
green leafy vegetables, which is commonly available in Uluberia area. Okay.
yes,
So you cannot simply go and suggest something which is very outlandish. Okay. So this can be an important barrier. So you need to know the cultural context. You need to know your target audience in order to deliver your messages. You cannot sit in Uluberia and give messages as if you are sitting in USA. Okay. So that is one of the important barriers. Then you have time constraints. Most of us don't have enough time to talk to people. That is an important barrier. Health literacy barrier. You think that a patient should not know certain jargons. You should not always throw jargons whenever you are giving a health education message. You should use as simple terminologies as possible so that the patient can understand. Then, as I said, there can be psychological barriers, like suppose you're talking to a teenager about his or her sexual exposure in front of his or her parents. That is a stigma for that particular teenager. So he will not open up. So you need to take that teenager to a private place and then communicate and give them that environment where they can open up in front of you. Also, suppose the emotional, he simply had an accident or some death in his family, and that time you want to counseling about diabetes prevention. So will that be effective? Is he in that state of mind to listen? No. So these barriers you have to make sure are not there when you are trying to deliver a health communication message. And finally, there can be physical barriers. You're doing a counseling session in a crowded OPD where other patients are shouting and they're dancing over your head. That is not a very good environment to deliver a counseling session. A counseling session should be in a dedicated room with less barriers, where there is less noise and you have a good one-to-one understanding with the patient. So these kinds of physical barriers, environmental barriers, you should be getting rid of. Okay, so suppose also you're talking about contraceptive to a couple and there are multiple other people standing there. That is also not a good sign. You need to have privacy there. So these are the barriers which are sometimes a long question comes. What are the types of communication and what are the barriers of communication? Okay, so there you have to jot down these barrier points. Clear? So this was all about today's class. We have learned the definition of health communication. We have learned the various levels which health communication addresses, cognitive, affective, and psychomotor domains. We have learned about two very important models, the Bordelow's model and the Shannon-Weaver's model. And then we learned about little bit about the gather approach. And we have learned about the various group techniques where most importantly, I said the difference between panel discussion and symposium is asked. Clear?